Hello, I'm Dr. Gerald Chodak, and this is prostatevideos.com. In this video, I want to talk about high-intensity focused ultrasound, a procedure in which ultrasound beams are focused into the prostate gland, having an ultrasound probe inside the rectum. And by delivering these focused beams, there's a heat generated that's able to damage or kill cells inside the prostate. This treatment has been in use for some time, certainly more than 5 years. Mostly it's been done outside the United States. Unfortunately, we don't have any survival reports to know what are the long-term effects at 10 or 15 years. We do have some information about either controlling the PSA or having a positive biopsy. And although it's difficult to make really fair comparisons to other types of treatment, it certainly does look like the effectiveness of the high-intensity focused ultrasound is showing inferior results to other treatments available. Now, without doing a randomized study, it would be very difficult to make actually firm conclusions. But based on the information we have so far, there's too many men that are getting recurrences or failing to have their cancer disappear compared to the other methods we have for treating this disease. We also, until we get more information about the quality of life impact, we can't tell men what proportion will have problems with urinary difficulties or bowel function, and there is a possibility of needing treatment for urinary obstruction as a result of undergoing this therapy. In fact, with some of the patients that are being treated, they're actually getting treated with a procedure or operation to improve urination and remove some prostate tissue because they may have trouble urinating when recovering from high-intensity ultrasound. So this is a work in progress, and some men will decide to undergo it. If they want it done and you're living in the United States, then you'll have to go outside the United States, and there are places that can be done, either in Canada or on the east and west coast. You can go outside to either the Bahamas or even, I believe, to Mexico. It's very costly, and insurance companies are unlikely to pay for it at the present time. Hopefully, we'll learn more from the ongoing trial, but until that time, I would tell patients to consider this as a cautionary treatment, that there's just not enough long-term information to be able to tell if it's a good enough therapy for those men that really need to be treated. Now, if you do have a low-risk prostate cancer, which is a PSA that is under 10, a Gleason score of 6, and you either have a T1C or a T2A tumor, well, it may be a reasonable option to consider because even in that group of patients, no therapy at all has very good long-term results. So this treatment may not be any worse than that. But if a man can't accept active surveillance and doesn't want to embark on one of the other therapies available, HIFU might be worth considering if you accept all of the uncertainties we currently have. The bottom line is we need more information. Hopefully it'll be forthcoming, and hopefully this information will provide you with useful tools to decide if this treatment is right for you. Thank you for watching.